Hi, I'm bgarlock with the Wahoo FCCLA chapter at Wahoo High School. I'm doing career investigation on a physician assistant level 2. Here's my table of contents and my planning process. I identified that with a growing and aging population, the demand for doctors and healthcare workers is expected to grow by 31% in the next decade. And my goal with that was to fully understand what it meant to be a physician assistant and opportunities offered with courses I can take to get there. And I formed a plan to learn more about my career. And in researching the career, I presented my project to my life skills class in high school. And after presenting, I still am interested in being a physician assistant and am excited to learn more. There's evidence of my online summary and my self-assessment. So my personal interests include painting, brain teasers, and baking. I enjoy working around kids and spending time with them. And my favorite subject in school has always been math because I love learning and working on challenging subjects. Extracurriculars I'm in include math club, wrestling managing, and FCCLA. Some of my values were health, wealth, education, knowledge, family, and freedom. And those relate with the medical field. In health, you're working to better the health of your patients. Wealth, typically careers in the medical field tend to make a lot of money. Their salaries high. Education and knowledge, it takes a lot of school and education to get there. Family, you work directly with families and around families. And freedom, you have some freedoms to choose which area of medicine you want to go into and some of your hours even. Some skills I have, I'm great at dealing with crisis situations. I can handle criticism well, so feedback from people wouldn't really be a problem. And I'm persuasive and realistic. I can just tell it how it is straight up. And I'm left brain, which means mostly analytical or methodical, like a logical thinker. And some of my traits, ESTP, which meant extroverted, sensing, thinking, perceiving, also known as a dynamo thinker because of their high energy and active approach in life. My learning skills were auditory, just listening, kinesthetic, more hands-on, and visual, like watching. And careers that related directly with those skills and traits was a paramedic or EMT and a medical doctor, which also closely relate to a physician assistant. Evidence of my career research. The job role, requirements, and salary with being a physician assistant. They get to work in all areas of medicine, like primary care, family medicine, emergency medicine, surgery, and psychiatry. They practice on teams with physicians and surgeons to examine, diagnose, and treat patients, and even educate and counsel families and patients, as well as prescribe meds. Steps to take to become a PA: earn your bachelor's degree, earn a master's degree, pass the physician assistant national certifying exam, secure a state license, and then find employment. And the PA job was expected to grow 31% in the next decade because PAs can be trained much faster than regular physicians. And annually, they make about $112,000 as of May 2019. Some of my duties and responsibilities. Growing up, I was the second oldest in a house of 6, so whenever either of my younger siblings were hurt or needed somebody, I had to be there. And that's kind of when I picked up that sort of need to want to help people. I was always playing doctor and trying to be the hero, and I still am. I still want to take care of people. And physician assistants are much like physicians, with having a lot of the same duties and responsibilities. The only big difference between the two is that PAs need supervision and physicians can practice on their own. However, PAs might be the primary care provider in a clinic when the physician is only there 1 or 2 days a week. Experiences I have. My 8th grade year, I was sent a letter from a couple of universities asking me to attend their summer programs where I had the opportunity to learn new stuff in the medical field and even watch a surgery be performed. And I plan to have an interview discussion with Nate Kutera, a PA from the local hospital, and hopefully be able to shadow somebody at the hospital my junior year. Samples of my schoolwork. Some classes I have to help prepare me for my future career were Honors Algebra 2, Honors Biology, and an Odyssey Ware nursing class I'm in. Other classes I can take that are really challenging were some harder math classes such as pre-calculus or calculus, some science courses like human anatomy that relate directly with the medical field, and a medical terminology college class. The use of Family and Consumer Sciences. Family and Consumer Science Standards 2.1.1 through 3. We use the Occupational Outlook Handbook to research career and demand opportunities. And after researching, we presented to our classes about our careers and took a personality test to identify our strengths and weaknesses when it comes to the career field opportunities we had. Purposes of FCCLA were to provide opportunities for personal development and prepare us for our adult life, and to promote a greater understanding between youth and adults, and develop an interest in family and consumer sciences, as well as family and consumer science careers and related occupations. My career planning. So for several years, I had my heart set on becoming a surgeon. It is just absolutely what I wanted to do. But just recently, when exploring other career choices in the medical field that may be cheaper to attend school and take even less time, I learned about being a PA, which was very exciting. I would still get to help others and even assist with surgeries in the OR. And I plan to get my degrees at UNMC after graduating high school. And like I said, I plan to graduate from Wahoo High spring 2023, then attend University of Nebraska Medical Center fall 2023. And over the course of 4 years, hopefully obtain my bachelor's degree at that university. And then in 2029, graduate the university with both my master's and bachelor's degree, and later apply for a physician assistant job. My works cited. And some questions to this project were, what is one skill that you learned or improved upon during your project that you will use in school next year or in your future? When taking that personality test, I learned a lot about my personality and some careers that relate directly with it or are similar to it. And I think that was really nice because I did find like a medical doctor or a paramedic worked best with my personality. What obstacles caused challenges in your work and how did you address them? Being in a pandemic right now, I didn't have the same opportunities I would have, like shadowing somebody at the hospital or even having a face-to-face interview. Thank you.